Hey there, I'm Dr. Daniel Hammer. I'm the hospitalist here at Claiborne Medical Center. I'm going to talk to you all a little bit about diverticulitis. Diverticulosis and diverticulitis, they're commonly misunderstood that they're not the same thing. Diverticulosis, real briefly, obviously, is just little outpouchings of the walls of the colon, usually due to diet, could be due to genetics, smoking, lack of exercise, or even just poor weight. That's diverticulosis, just the presence of that. Most people with diverticulosis don't have any symptoms, but it's the inflammation of those outpouchings that causes diverticulitis. That's when medical intervention is necessary. And so really the early symptoms of diverticulitis would be some abdominal pain. It's usually in the left lower quadrant of the abdomen. You may have some nausea, obviously decreased appetite, but definitely tender in that area. Some people may experience some bleeding. That's not necessarily common. So with the way you diagnose that is obviously physical exam, palpating all over the belly. Again, more typically tender in the left lower quadrant because it's most common in the sigmoid colon. And then CT scan to confirm the diagnosis. And what you'll see is inflammation of the wall of the colon in that area. You can have diverticulitis anywhere, but sigmoid and descending most common. And after that, it would be, if the patient is non-septic, if the white blood cell count's normal, you can treat with oral antibiotics, not necessarily needing hospitalization. But if there's evidence of sepsis or white blood cell counts elevated or fever and systemic symptoms, then you would need to most likely admit to the hospital for IV antibiotics, at least for a brief course. Some of the complications that you can get with that is perforation of the colonic wall, and this can cause infection or inflammation of the lining of the stomach called peritonitis. It can also cause an abscess to form. These things don't necessarily require surgery, but do sometimes lead to that. And surgical intervention obviously would be to wash out the belly and then most likely removing part of the colon. As far as once diverticulitis resolves, usually with a 10 to 14 day course of antibiotics, again with sepsis, IV first, and then transitioning to orals. Once it resolves, people should proceed with a colonoscopy, usually within 4 weeks. You don't want to do this in the acute phase because the colon is more friable and more likely to perf. But once it resolves, you do want to have a colonoscopy if you haven't had one recently, because diverticulitis can be a presenting symptom of colon cancer. So we want to make sure that that's been ruled out. As far as diet going forward, you want to eat a diet high in fiber. That typically they say to avoid nuts, seeds, things like that, popcorn. We have seen that those things tend to lead to more episodes of diverticulitis, but nuts also tend to be higher in fiber. So you want to eat a high fiber diet, a diet low in red meats, exercise regularly, and those are things that hopefully will prevent future episodes, but with the presence of diverticulosis, we can't rule that out altogether. So that's kind of the rundown for diverticulitis, quick and dirty.